It would have a huge impact. I mean, we know that it's a vaccine that doesn't need the same sort of cold chain that the Pfizer and Moderna vaccines need. So it's something that can be stable within a fridge and administered as normally other vaccines are administered. That would have a huge impact, as you say, not just in the UK, but across the world. It's also the cheapest vaccine, and it's a vaccine that many lower middle income countries have been relying on as part of their vaccine programs. As for the UK has ordered about 100 million doses of the AstraZeneca Oxford vaccine, which is far greater than the Pfizer and the Moderna vaccines. And it would enable them to expand the vaccination program to the entire population rather than just particular vulnerable groups.
And I want to turn to what's happening in the UK, because not only are the number of cases rising, but we've identified at least 2 strains of or variants of the initial coronavirus mutations that have been spreading quite rapidly. And the findings are showing that these new strains are a lot more transmissible, but probably a little less fatalistic than the initial strain. Putting all of that together, does it make you less concerned about the impact that these new strains could have in terms of the mortality rate?
No, I think the current data suggests that they're about 50 to 60% more transmissible, and the severity doesn't appear to be very different from the ordinary strain. Overall, a strain will do much more harm if it's more transmissible compared to if it's more fatal, because we know that spread is exponential. So a strain being 50 to 60% more transmissible makes the virus very hard to control. And this means, for example, that lockdowns or restrictions may not have the impact that they have normally within a population. It also means that we need much higher vaccine uptake to be able to contain the virus. So it makes pandemic containment very, very hard with the strain being more transmissible. And ultimately, it leads to many more deaths, irrespective of the fatality rate.
Right, and if you look at the number of inoculations that have occurred, yesterday the government published data showing that 600,000 people have already received the jab. Are we vaccinating fast enough to keep up with the spread of this new mutation or new virus that's going, so quickly through communities right now?
I think the simple answer to that is no. The vaccination is not keeping up with it and will not be able to keep up with it. And that's why we cannot rely on vaccination as the only way to contain the virus at this moment. We can see that it's rapidly spreading through the population. Our hospitals in the UK are currently at capacity, and they're hospitals that are falling short of oxygen. We really, really need other measures. So strict restriction, control of transmission within schools, places where we know transmission is happening, quarantine at borders, strict enforcement of isolation and support of isolation within communities, and good surveillance and detection of cases. Unless we do all of this, there is no way we'll be able to keep on top of this, because vaccination by itself is not going to be sufficient or fast enough.